Hello, Smile Share Nation. Welcome back. Happy New Year. It's Tuesday. It's a little after 1. I apologize for being tardy, but we are back this year doing lives. We had so much fun doing the lives with the Anti-Bullying Month last October that the team voted to bring it back this year. We're going to be doing these sessions every other Tuesday to try to educate, get to know each other a little bit better, for you to get to know what we do at Pesh Orthodontics and our team a little bit better. So for today's live, Crystal and Brittany had selected the importance of orthodontics and for us to talk about how it's not just about vanity. And you know, this time of year in January is time for new beginnings, new year. A lot of people are getting back to the gym. The gyms are full. We're looking at self-improvement, including how to improve our self-confidence with, you know, how many pounds we packed on before the end of the year, feeling better about our appearance. You know, we got Christmas, there was a bunch of makeup given, there was a bunch of, you know, smiles given, and so feeling confident about ourselves and the way we look and the way we feel and our health is a focus at this time of year. And orthodontics fits in, you know, to solving some of those issues for you know, our friends and family and loved ones. But I'm here to let you know that it's just not about vanity in and of itself. Although, you know, want always beats need, and we always want to look better, we also want to feel better and feel healthier too. And so feeling better about how our teeth look and fit together, you know, it goes hand in hand. So with that being said, we have a couple of questions that Crystal and Brittany had put together for me to just kind of chat about a little bit, and then we'll open up the discussion for other questions for people that are tuning in live, and that's what we'll do, you know, as a matter of routine as we move forward this year and have these opportunities for us to connect, you know. So first question is, what is orthodontics? You know, at the end of the day, orthodontics is a service. It's not a commodity, although it's becoming more commoditized in our world today, like a lot of different things. But you know, there's a nuance between an office that is offering orthodontics, which is a service, and then being able to advertise that you are an orthodontist. It's a real subtle nuance, but in the specialties in dentistry, a dentist can do a lot of different things. And so some of you may know this, but I was a family dentist before I specialized in orthodontics, and had an opportunity to teach in the restorative department at Loma Linda for a couple years while I was in private practice. And I actually never did orthodontics as a family dentist. Part of it is because the amount of training that we get as dentists in our undergraduate training, which isn't necessarily undergraduate as you would normally think of it. You know, as we go into college and university and we pick a major, you can major in a lot of different things and become a physician or a dentist. I just so happened to major in biology, and I thought I wanted to go into medicine for the longest time, and then I decided I didn't. And then I went back and forth with what I wanted to do, and I was taking some engineering classes, and I played the fence on bioengineering, and then ended up deciding to be a biology major, right? So when I got to dental school, though, I realized that there were a lot of other paths to get to dental school. We had art majors in our class. We had music majors in our class. And that was really revealing to me or enlightening. But that, dental schools, they want to get a variety of people with a lot of different interests and passions, and not just in the sciences. And so at the end of the day, we go into dentistry and we become dentists, but the amount of training that we get in orthodontics is very limited. At least it was in my experience. And so when I was a general dentist, I didn't really dabble in orthodontics. There were other things, I did root canals. I'm going off a tangent here a little bit, but at the end of the day, the only person that can call themselves an orthodontist is a general dentist that has gone through more training, right? Even though a general dentist can do orthodontics, even though a general dentist can take out wisdom teeth, but they don't call themselves oral surgeons or they don't call themselves endodontists because they can do a root canal. That's the subtle nuance in the difference between being an orthodontist and doing orthodontics. But at the end of the day, orthodontics, when the question is asked, what is orthodontics? It's a service. It's not a commodity or product. We, as orthodontists, we use different appliances to move teeth. And it can be braces, it can be Invisalign, it can be behind the teeth braces. As orthodontists that we move teeth, we also have the ability to move jaws orthopedically. And that's why we have kids that we say we want to see kids at age 8. By age 7, 8 is great, 9 is fine, because we're checking for growth issues and airway issues and things like that, that as orthodontists that we were trained to look at growth and development a little bit differently than general dentists, because there just isn't enough time to learn about everything in 4 years of dental school, right? So, so an orthodontist, that was the next question. I'm going all over the map, aren't I? So you guys have thought this through. Thank you for that. What is an orthodontist? So an orthodontist is somebody who just specializes in orthodontics and moving teeth and dental facial orthopedics, which is moving jaws. We don't do fillings, we don't do root canals, we don't do a lot of the other things that you'd find at a family dentist. And this was a fun fact from the American Association of Orthodontists, that for every opening in an orthodontic residency, there's 15 general dentists that apply for that spot. And so I had not read that recently, but that's an interesting fact. Next question is, how and why is an orthodontist different than a general dentist? And I kind of touched on a little bit of those. But we choose to limit our practice, the scope of our practice, to moving teeth and moving jaws. And fun fact, there's over 3,700 hours of specialized training that goes into the average residency, and I had not added that up. But it's a significant amount of time. So that translates into about 2.5, 3 years of dedicated education just on the study of orthodontics and dental facial orthopedics. And so you may see on the initials on some of the doctors, like I have a DDS, and that means a doctorate of dental surgery, okay? And I went to school at Loma Linda University for both my undergraduate dental degree, or the DDS, and I also went to Loma Linda University for my master's in orthodontics and dental facial orthopedics, and that was an MS, right? And so you will see a lot of initial behind some doctors and physicians, right? And so the DDS is usually a West Coast school, the Doctorate of Dental Surgery. They're the DMDs of Doctor of Medical Dentistry. By and large, it's not a hard and fast rule, but are usually more East Coast schools. So a DMD and a DDS essentially mean the same thing. You once you have that, you can apply for the state licensure to practice dentistry, right? The MS for me is my master's. You'll see some schools, they do a MSD, which is a Master of Science in Dentistry. And so as a part of my graduate training in orthodontics and dental facial orthopedics, we present a thesis, okay? And then you have to defend the thesis just like, going to grad school. So there are some programs where you don't necessarily have the opportunity to present a master's and do the research, but that was my experience. And so that's where the extra hours come in. Let's see. So why is it important to see an orthodontist versus a general dentist that's doing orthodontics? Now, quite honestly, I've seen some general dentists do some really good orthodontic work. It's just like anything else. There's people that are doing a really good job, and some people that care above and beyond the really good job, and they really hone their craft. I love Malcolm Gladwell. He's an author. Some of you guys may have read his stuff. If you have, smash the like button. Let us know. But he is a favorite, and our team, we gave out some books at our Christmas party, and Malcolm Gladwell is actually the focus around the reading that we're doing this year. And one of his books is Outliers. And in that book, Malcolm Gladwell talks about this rule of 10,000 hours. And the idea is whether or not you are a Tiger Woods or you're a Michael Jordan, or whatever you do for your business or school, you've got to practice, and you've got to do it over and over, and practice makes better, and I'm a firm believer of that. And so when you limit your scope of practice as a dentist and as an orthodontist, you get better at it, right? And so one of the things that I was told when I was going out and doing family dentistry was that it was going to take some time before I felt comfortable, doing fillings and doing crowns and some of the things that general dentists do. But it's a matter of repetition, and it's true. It took me about a year as an associate dentist in private practice to where I felt like I really owned my craft, right? And the reason it took about a year is you have a shorter feedback loop as a dentist. When you cut a filling and you fill a filling and then you check somebody's bite, for an example, they're going to tell you if it feels high or not, and you can adjust it. And maybe you've had that experience yourself where you've gone to the dentist and they put a filling in and it felt good, but you were numb, and then a couple days later you're like, I feel like I'm hitting on something, and you feel high. Well, the dentist has an opportunity to correct that sooner, right? And you get in and they adjust it and you feel great, and it's like, oh, you're amazing, and it looks good. And so you get that feedback loop pretty quick. In orthodontics, when you start treatment, on average, it's 1.5 to 2 years on a full comprehensive case. And so you don't get the immediate feedback of, like, say you do a filling and that filling is done within that half-hour or hour appointment, and then you get the feedback, a couple days later if you heard anything, you knew, and then life goes on. With orthodontics, the feedback loop and the turnaround time is a little bit longer. And I remember hearing someone say, it's going to take 7 years before you feel comfortable as an orthodontist. And I was like, what, are you kidding me? Like 7 years? I feel like, coming out of graduate school, like, I know some stuff. I've learned some stuff. And, like 3,700 hours of education, I should know what I'm doing, right? But the reality is, you don't know what you don't know. And I would say that doctor that gave me that pearl of wisdom of about 7 years is about right. I graduated from Loma Linda in my master's program, and my specialty in orthodontics and dental facial orthopedics in 2005. So, you know, it's been a couple more years than the 7, but you know, I learn stuff every day, and it's something that we pride ourselves here at Pesh Orthodontics of doing, of always improving. And so, you know, you look at your cases that you did early on, and you go back and you critique it, and what would I have done better, what did I do well, and you only get that opportunity if you're doing more cases, right? And so as an orthodontist, when you limit your practice and that's all you do, we're bound to get better at it than a family dentist that's dabbling in and doing a couple of cases here or there, whether it be with Invisalign or whether it be with braces. One of the partners that we have at Pesh Orthodontics is an oral surgeon, Dr. Dale Stringer. He's over in Riverside. And we work with a lot of oral surgeons in the area that are excellent. Dr. Pledger, Dr. Koyak, Dr. Svetov, Dr. Whitworth, the list goes on. But not all of them do jaw surgery. And we do a lot of jaw surgery cases here in our practice, and Dr. Stringer does, I would say, the majority of those. And the reason why I like using him for jaw surgery cases is he does a lot of jaw surgery cases. He does more jaw surgery cases than most oral surgeons, you know, period. So and if I need a jaw surgery, that's who I would want to go to, and that's why we refer our jaw surgery and orthognathic surgery cases to Dr. Dale Stringer in Riverside. So same, if I needed a surgery, you know, I would want to go to a surgeon who does a lot of those things. And I talked too long and my tablet timed off, so let's see what the next question is. I'm excited. Are you guys excited? Smash the like button. Make me feel the love. Let's see. Okay, so why is it important? So because we get so much experience and we put in so much time and training, we can identify the problems that are developing with teeth and look at things like airway that tie into why the teeth do some of the funny things that they do. Form follows function. Have you ever heard that? Okay, yes, Brittany has, because she's heard me in the consults. Like every time, form follows function, right? So when we're not able to breathe through our nose and we're breathing through our mouth and the tongue stays down, the upper arch tends to collapse and we get dental crowding on top and bottom. Again, orthodontics, going back to the topic of the chat for today, is it's not just about vanity, right? And so another question is, why is it not just about pretty teeth? Okay, we talked about that before. We'll talk about it again. Orthodontic treatment is far more than simply treating how teeth look. It's about aligning teeth and jaws so that they meet and function effectively, right? So we talk in our consultations a lot about the shoebox analogy. And so you have an upper lid and you've got a lower lid, right? And everybody knows what a shoebox looks like. And not only is the upper lid wider than the lower lid, but the corners of the box have to line up. And sometimes with our bite, the corners of the bite where the canines are and the first molars, they don't line up right. And so what happens is you have these misaligned gears. Now you take your car and those gears aren't aligned, what's going to happen? Things are going to wear, they're going to break down faster than they would if they were in alignment, like a zipper, right? And so malocclusion is just another name for saying bad bite. So if the bite's bad, not good things are going to happen, right? So when malware, right? You got computers, you don't want that stuff. Something bad's going to happen. So malocclusion is kind of the same thing. My mission, among other things, is to wipe out malocclusion. Now, it's going to take a lifetime to do it, and I need my other orthodontic friends to help us eradicate malocclusion. We're not curing cancer, and we're talking about teeth, but it's important. And why is it important? Because there's something called self-image, there's something called self-confidence, there's something called health, right? So when our teeth are more crowded, it's harder to take care of them. We don't want to take care of them sometimes because they don't look like we want them to look. But when we trap bacteria and plaque and things like that, it can, predispose us to other things like heart disease, and our good family dentists and partners in the area can talk to you all about that too. But the cascade of events that come from just a simple thing like gingivitis and periodontitis, and the breakdown where we start losing soft tissues and hard tissues around the teeth. Okay, this is pretty serious stuff, but we have a lot of fun taking care of and wiping out malocclusions. Okay, let's see. So leaving misaligned teeth to get untreated may lead to other dental problems such as tooth decay. I didn't touch on that. I did touch on gum disease, abnormal wear of the teeth. Like when you're hitting, and we look at this when patients come in and we do our simulations, I call it a heat map. It's like a Doppler where we can see how the teeth are touching, kind of like the dentists do when they check your bite after you get a filling with the marking paper. If you're hitting hard on one side or the other, it can lead to breakdown in the joints, right? It can lead to breakdown or uneven wear on the teeth. Go back to the car analogy. Say you have tires. How many of you guys have had to replace your tires in the last year? Smash the like button, right? So when you go back to tires, I always go back to, well, have you been properly inflating your tires? So if you have tires that are underinflated or overinflated, what's going to happen? They're going to wear down faster, right? And then you got to replace your tires. Well, we're not dealing with tires here. We're talking about teeth, and you've only got one permanent set. So the idea of dialing in the bite so that the teeth wear more evenly, that you chew your food more efficiently, helps with digestion. These are all things that are just not about vanity. Even though we all want things to look good, and we all want to feel good about ourselves, but knowing that your teeth and your bite is right can be just as comforting as looking in the mirror and saying, dang, I look good. Okay, so those were all the questions that Brittany and Crystal had prepared for me to kind of touch on. Are you guys having fun? Are you guys learning anything? Smash the like button. Are some of these things that you knew already because you're part of our Smile Share Nation and family, and we've taught you some of these things? Smash the like button. Great. Okay, so at this time, we will open it up to our listening audience for a couple of questions. Brittany, did we have anybody that had any questions? May not happen this first time. I don't know how many people are actually tuning in today, or will be rewatching this live, but if you're rewatching it or you're watching it now, you can always send in your questions, and if we don't have time to answer it today, we'll be sure to put it on the schedule for next time. So
we had a couple of questions come through, but you're pretty thorough, so you've answered some of them. What age is normal for treatment?
Great question. We love that question. The American Association of Orthodontics recommends that all kids come in by age 7 to get an orthodontic screening. Now, are we putting bracelets on every 7-year-old that comes in, or are we doing an expander on every 7-year-old that comes in? No. But the idea is by age 7, all kids, whether mom had braces or dad had braces or not, or an Invisalign, it's a complimentary service that we provide to the community. You come in, we get a baseline. We take a look at what we call a panoramic x-ray, where we can see all the teeth at the same time, see if there's anything missing, see if we have anything extra that needs to be dealt with. We do a measurement for airway and maxillary width to make sure that things are normal and that we're breathing through our nose, because you know, that we don't have any goofy habits like sucking on our thumb, or we're still using a pacifier, or, you know, mouth breathing. Sometimes there's large adenoids or tonsils, sometimes there's a deviated septum. You got another?
Yeah, I have
We're
one
good.
more. Yeah, but
Okay,
you're good. I would
roll in. Okay, but bottom line, age 7 is when we start screening, but it's never too late. So if you've never had an orthodontic consultation, it's January, we're starting a new year, we got time to look at it, right? And so one of the things that we've done is to make it easier for patients, because everybody's busy and there's never a good time to make doctor's appointments, is last year we went virtual, and it's been amazing at the traction that we've been getting, and the more people that are finding out about our virtual if we need to take an x-ray and have you into the office, we can do that. And especially for the little ones, if you haven't seen an orthodontist by age 7, I do recommend coming into the office so we can take a panoramic x-ray, because I don't have x-ray vision. The pictures are great with virtual, but if on the little ones, we do like to get an x-ray to confirm, so whether or not you're little or 7 or 70 and you do the virtual consult, just be rest assured when you come into the office and we do our records, we're going to take a lateral cephalometric head film, and we're going to take a panoramic x-ray just to confirm our diagnosis, right? And since we do a lot, right, and we've gone past the 10,000 Maxwell, Malcolm Gladwell hours on the outliers, it helps us. So we get pretty good with the virtual, but we do like to back things up with our records. Did that answer the question?
Yeah.
Yes?
We did
Great.
have a couple of people who said that they did not know that they needed to bring their children in at that young, so they appreciate you clarifying that.
Yeah, and the idea is it's peace of mind, right? So if the kids aren't ready at 7 for any early intervention, that's fantastic. We put them into our observation and growth program, where we check, every 6 months to a year or more, depending on what we see on that initial screening.
Another one asked, how does it work? But you kind of touched on that already. And then who can benefit from orthodontics?
Well, honestly, anybody with a malocclusion is going to benefit from orthodontics. Okay, so that could be one crooked tooth, or it could be a complete overbite or underbite where the jaws are misaligned, right? So at the end of the day, we can help a lot of people, and you'd also be interested to know that now, as of this year, the American Association of Orthodontics said, as a population of orthodontists nationwide, we treat more adults than we treat kids. So I think it's a common misperception that when patients come in, sometimes they see our office and there's a lot of kids, and they may not see an adult when they're coming in after school, and they're pleasantly surprised to learn when we talk about, we treat adults too. We treat a lot of adults, we treat a lot of kids, and it's trending more towards, treating adults. Part of that has to do with birth rates and things, and it has to do with the fact that adults don't tend to want to have braces, percentage-wise. I would say 80% of adults would rather go into behind the teeth braces or Invisalign versus the idea of having to go into braces. Some of those patients of, I'm too old to have braces put back on. Other adults don't mind. We have clear braces, we have metal braces, but honestly, the clear aligner technology has allowed us to treat more adults. And you know, initially we were a little hesitant when 20 years ago, we weren't convinced in the technology that Invisalign was really going to be what it is today. And so we didn't want to treat anybody except for adults because we thought the compliance issue would be better with adults than it would be with teens or even little kids. And you know, initially it was an issue with the software where, you know, communicating what we wanted to do with the teeth, we had to, you know, type things in, and Invisalign at that time, they still have, their hub is in Costa Rica, and so sometimes there was a language barrier of communicating what we wanted to do with the teeth back and forth, and you're, you know, translating from English to Spanish. And the tipping point for me with Invisalign was then when they put the software in the doctor's hands. And so that's something that some of these other companies that are trying to get into the space that Invisalign has pioneered are having a tougher time to do. And they'll get there, but it's going to take a while for them to catch up. Quite honestly, is the software that Invisalign has, which is a behind the scenes thing, and you know, myself and other doctors that are actually using the product, we have control now. And so we were really able to take off and push the envelope on how to use Invisalign after ClinCheck software was developed. And there's been several iterations of the software itself, but now I don't have as much of a communication problem to get out of the software and the plastic what I need as the orthodontist, right? So what has happened out of that is sprung out, you know, now we're treating teens, and teens are actually better patients than the adults, quite honestly, and their teeth move a little bit faster and a little bit easier, and the little kids do great too with Invisalign First. But I would say, you know, that is really what's tipped the scales with us treating more adults, even though they're not necessarily as good as some of the teens and the kids, as what they want to be sometimes. Invisalign is great. It works for patients that are committed to improving their health and their appearance and their self-confidence. I would say what has really helped our practice and office over the last year and a half is implementing our remote monitoring program, because at the end of the day, Invisalign is as successful as we can keep patients accountable. And so now I see all of my patients on a weekly basis, whether they like it or not. And more of them like it than don't, especially with the really neat morphing feature on the app where they can monitor their progress. And that's the key with successful orthodontic treatment, is really staying motivated and being able to see the light at the end of the tunnel, you know. And I can tell patients till I'm blue in the face, you know, you need to wear your aligners 22 hours a day if you want to make this work. There's a lot of misinformation out there, you know, companies like Smile Direct advertising, well, you only have to wear them at nighttime and this and that, and you don't need attachments on the teeth, and we can do it without interproximal reduction or IPR. And yes, it's true to a point, but if you're looking for the level of detail and outcome that you would expect from an orthodontic specialist like myself, my hands are tied if we can't use attachments with Invisalign, right? Like a Smile Direct solution. It would almost be like saying, you can have braces, but I'm not going to give you the wires, right? People would scratch their head and say, well, that doesn't make sense. You know, I know enough to know that if we're going to be straightening my teeth with braces, I'm going to need the wires too, right? And the answer would be yes, because it's a system. You need both in order to create a force in a moment to move those teeth. And the same is true about Invisalign. Invisalign works better when there's attachments. It's a system. The plastic needs attachments, not for all movements, but that's why we use attachments and why we change attachments out during the course of treatment in order to get is some of the movements we have. We have to think like orthodontists and use those principles, whether we're using Invisalign or we're using braces to straighten the teeth or get the bite bend. That was pretty technical. I can't read that one. There's another question?
Next week, or next one, is gonna be on the 25th.
Yes. So thank you for popping in. Hopefully you have a little bit of your lunchtime left to enjoy. We will be back, not next Tuesday, but the Tuesday after that, which is
The 25th at 1 o'clock.
25th of December, or January, because it is 2022. I'm still getting used to writing that. How about you? Smash the like button. 2022 is going to be an amazing year. It's got to smash 2021. Would you agree? Yes. Thank you, Smile Share Nation, for tuning in. We're looking forward to connecting with you this year. Make it a great day and keep smiling.